Good morning, everyone. I bring greetings from Nigeria, and we're glad to be here. In the next few minutes, I want to talk to us about some of the work we've been able to do with the use of AI technology. And this is important because in the current situations of funding, we need to look at more efficient ways, to do our work. And so, this is an introduction, is a picture, and right before you is our institute, where we've been working for 20 years in research and public health implementation and capacity building in Nigeria, Africa, and beyond. And that's the Institute of Human Virology, Nigeria. So on disclosure, nothing to disclose. Okay, so as an introduction, you know that tuberculosis is a disease and caused by this bacteria that's been discovered since 1824. And then we've had various efforts to try to eliminate this disease. However, we discover in this present age, advent of technology and AI, and we've now, of course, must have to work with what we have to get much more with the limited resources we have. So this particular work was done under programmatic implementation setting in Nigeria. And so we worked with one of our tech partners to develop what we call its map hotspot mapping. So what that means is we look at unlike before in the TB program, where when we have incidences or cases of TB, then we look at what more we can do. We try and search around, do contact tracing, and then to find more cases. But then we needed to do more, now that we have technology. So in Nigeria, we have, especially at the community level, we have some groups of people we call the community TB workers. And these, they stay around the community or walk around the community among the people. So they go to maybe house to house or they live among the people. And we decided to now enhance their work by trying to give them more direction as to where they will be able to get more cases of tuberculosis. And this was what we were able to do. And once they get some form of cases, we feed this particular model, with this history, and then the platform becomes more intelligent to be able to direct them more to where they will get, more cases. And this has proved along the line to give us so much more. And the beauty of it also is, aside the state level or regional level data, it can get to the world level. In Nigeria, we also have what we call the granular level, is like the world level, where the people stay in the community level. So this also drills down to get those cases there. And also through the AI, like I explained, we preload the system, and then with historical data, like from cases that have been found before, and then it builds up a predictive intelligence, to give more guidance. Prof. Grant said in one of during his lecture that to reduce incidence, we need to do active case finding. This is exactly what this model has tried to do for us, and to screen more people. So this is a form of targeted active case finding that we're trying to do at this community level. So aside, because these community workers, every day they go around the community, but now they won't just wake up to determine where do I go this morning. There's already a technology that has been fed, to be able to give a direction. And then interestingly, you see some of the results, which is quite, more impressive than the usual findings during programmatic implementation in terms of the yield and in terms of yield, both presumptive and the case finding yield. So when this is done, these groups of people now moves to those directions, and then with their several outreaches or targeted ACF, active case finding. And so in this particular study or work, we just looked at a month in a state in Nigeria. And interestingly, with this, we've also scaled up, working with other partners across the country, to give this. So in December, for instance, from those predictions, we're able to go into those wards and screened 22,771. And from there, 6,574 presumptive cases were found, which is a huge 30% yield. And so, of course, the usual workings we might not have up to this. Sometimes we have 10% yield, 12%, 15% yield. But this tech is actually making us more efficient. Then we can have the little resources and direct them to where we will get more results. And after that, if you look at the TB yield, is 15% above the usual implementation that goes around 9, 10, 11, 12%. And so we feel this is a good direction to go. And like I said, we've even also scaled up, to other parts of the country. And this to acknowledge, of course, the conference organizers, and then the Ministry of Health in Nigeria, the states which this study was done, the Global Fund funding this project, and all our sub-recipients, all this work all over the country with us on the grant. And then Instruct Global Health Solutions that are tech partners, and all healthcare workers, and to acknowledge all care recipients as well. In conclusion, current realities have shown that for us to eventually find and treat all missing TB cases, we will require technological innovations and drive to achieve this milestone, especially in the setting of dwindling funds, as even the minister talked about. Thank you very much for listening. This is Scan Code for more information about IBM. Thank you.